Most healthcare professionals are aware of how estradiol can increase cell proliferation and cancer via its ligand with the estrogen receptor on cell membranes, resulting in an upregulation of gene expression in the nucleus and mitochondria, along with modulating cell signaling agents. That's the right-hand side of this graphic. The left-hand side of the graphic is often overlooked, I'm afraid. It is the detoxification of estradiol, its metabolites, and their impact on cell proliferation, DNA adducts, and oxidative DNA. Perhaps it is believed that if estradiol synthesis is greatly reduced using an aromatase inhibitor, or if a selective estrogen receptor modulator like tamoxifen can interfere with the ligand between estradiol and its receptor, then that's sufficient. We believe that the left-hand side of this graphic is equally as important as the right, especially if a woman has genetic SNPs on one or more of the important genes involved in estradiol detoxification. This slide is a review of estrogen metabolism from the perspective of our detoxification genes. The molecules are color-coded to help you identify the good guys from the bad guys. In the case of estrone, it is yellow since it occupies a pivotal step in the biotransformation of 3 estrogen metabolites, 2-hydroxyestrone, 4-hydroxyestrone, and 16-alpha-hydroxyestrone. The genes controlling these biotransformations are CYP1A1, CYP1B1, and CYP3A4 respectively. I call this the first tier biotransformation process. The second tier takes 2-hydroxyestrone and 4-hydroxyestrone to its downstream metabolites, 2-methoxyestrone and 4-methoxyestrone respectively, and these are under the control of the gene COMT or catechol-methyltransferase. 16-alpha-hydroxyestrone is converted into estriol. 4-hydroxyestrone can also be converted into the 3,4-estrone quinones, which, as you can see, is a highly reactive molecule and is capable of generating DNA adducts either by itself or by free radicals. The first step in this process is to neutralize the free radicals to hydrogen peroxide by MNSOD, or superoxide dismutase gene, and converting the 3,4-estrone quinones into glutathione conjugates via the GST, or glutathione S transferase genes, GST M1, T1, and P1. SNPs on one or more of these genes involved in this estrogen detoxification process can alter this biochemical pathway and increase the risk of ER-positive breast cancer. Recent advances in genomic testing has now allowed us to evaluate the phase 1 detoxification genes associated with estrogen metabolism, as well as phase 2 detoxification genes. This test is called the estrogen gene test, and as you can see, we cover 6 different genes across many of the different biochemical pathways associated with estrogen metabolism. Until recently, research pertaining to the estrogen detoxification pathway focused on only maybe 1 gene, or at the most 2, and how it affected breast cancer risk. Cerny and her colleagues in 2011 described the impact of multiple gene SNPs within the estrogen detoxification pathway on ER-positive breast cancer risk among postmenopausal women. More than a 12-fold increase in breast cancer risk was observed when a woman had SNPs on CYP1B1, COMT, and MNSOD. And while the other combination of SNPs were significantly less than 12, SNP combinations in this estrogen gene pathway resulted in OR values greater than 2 for the following 2 SNP combinations, CYP1B1 and COMT, or COMT and MNSOD. For 3 SNP combinations, for example CYP1B1, COMT, and GSTP1, or COMT, GST, P1, and MNSOD, the OR values were likewise greater than 2. What accounts for a 12-fold increase in breast cancer risk among postmenopausal women for the SNP combination of CYP1B1, COMT, and MNSOD? Maybe the graphic we used previously to review estrogen detoxification will help with your understanding. A SNP on CYP1B1 preferentially converts estrone to 4-hydroxyestrone at the expense of 2-hydroxy and 16-alpha-hydroxyestrone. Minimizing the production of 16-alpha-hydroxyestrone is a good thing because, as you remember, 16-alpha is an undesirable estrogen metabolite. It also minimizes the production of 2-hydroxyestrone, which if we had a choice, more 2-hydroxyestrone or 4-hydroxyestrone, we would want the former. Maybe there's a way to boost 2-hydroxyestrone when there's a SNP on CYP1B1. Let's hold on to that thought. Remember, it's the combination of CYP1B1, COMT, and MNSOD that leads to a 12-fold increase in breast cancer risk. So what is it then about a SNP on COMT that increases a woman's risk? Remember, COMT is responsible for methylating 2-hydroxy and 4-hydroxyestrone. A SNP on COMT decreases the activity of this enzyme, routing 4-hydroxyestrone to the 3,4-estrone quinones, depicted here by the bold arrow, and resulting in higher levels of this DNA-disrupting estrogen molecule. On top of that, a SNP on MNSOD leads to lower levels of superoxide dismutase and less hydrogen peroxide, but more free radical production. This combination, CYP1B1, COMT, and MNSOD, is, if you will, a perfect storm. Too much 4-hydroxyestrone, too much 3,4-estrone quinones, and way too many free radicals, which DNA cannot recover, leading to a higher breast cancer risk. Fortunately, there are nutrigenomic interventions that can alter the expression of genes involved in estrogen detoxification and can mitigate the effects of SNPs on CYP1B1, COMT, and MNSOD. Some of you may be familiar with this concept. It's called nutrigenomics. Others may be hearing about it for the first time. Nutrients supplied either in our diet or by supplementation can upregulate or downregulate gene expression. I have discussed this process in detail and refer you to the GSN website, www.genomicsolutionsnow.com, if you're interested in learning more about this process.